been more than 2 decades since the first successful cord blood transfusion in 1988.
And currently, almost 80 diseases have shown a positive response to treatment using the stem cells contained in the blood from umbilical cords.
Still, only a minority of parents around the world choose to bank their baby's cord blood, either with private banks or public donor banks.
And with us to talk about this issue, we have the Medical Affairs Manager, Dr. Cherie Daly from the private cord blood bank, CordLife, and parent Louise Kahn, whose child has been treated successfully for cerebral palsy with her own cord blood. Well, good morning to both of you. Basically, what is cord blood banking? Why is it so important?
Cord blood banking is basically the collection of blood from the umbilical cord once the baby is born. So it's a once-in-a-lifetime opportunity, no risk to the mother or baby, and once it's collected, then it is processed in a laboratory like CordLife and stored in the future if any need arises for this cord blood. As you correctly said, over 80 diseases are currently being treated using umbilical cord blood. The reason why umbilical cord blood, why not bone marrow donors, why not peripheral blood? We know we can get stem cells from these 3 sources, and all 3 of these sources can be used to treat these 80-odd diseases. Cord blood has distinctive characteristics that makes it important. It's a primitive cell, so it can divide and replicate easier, and also cord blood is what we call immunologically immature. So with bone marrow, with peripheral blood, when we're looking for a donor in the family, we need a perfect tissue match, what we call a 6 out of 6 tissue match, which is often hard to find. With cord blood, we don't need this perfect match. So with parents banking their baby's umbilical cord blood, it's not just for that child, it's also possibly for family members, because we can have a great success rate of getting a match. Now, statistics have shown that the outcome of a transplant, the survival rate, is more than doubled if we use stem cells from a related donor compared to the international donor registries.
Louise, you've banked your baby's cord blood. Tell us more about your case and your baby's, what she went through.
Well, Georgia has just turned 3 yesterday, but so we had a very normal pregnancy and essentially a very healthy child, but we had a very poor birth essentially, and so she suffocated and had no oxygen, so has suffered a hypoxic injury, which basically means that when she stopped breathing in the birth canal, that affected her brain, so it was a brain injury she now suffers. So she's been diagnosed with cerebral palsy, and it's affected all her motor skills, her ability to be able to communicate, to be able to eat properly, be able to, she can't sit up unassisted, she is a long way from walking, so she has a lot of issues that she's up against, and long-term issues.
Are all parents given that option to bank their baby's blood?
We try to educate more and more parents. What we really would like to see is what's happened in the United States. Currently in the United States there's legislation in 20 states. The parents should be informed about the options of cord blood banking. So those are 3 options. You can throw your baby's cord blood away, you can store it privately, or you can store it in a public bank. And more parents are getting educated, but unfortunately there is a shortfall in this education procedure. The parents don't know the options available.
Louise, what was the case for you then? You decided to bank your baby's cord blood. What was the decision process that you had to make?
It's a fairly simple process. We'd seen the advertisements in our doctor's office. We looked into it more and more, and the more that we read about it, we felt that the technology was there to get these stem cells. And science over the next decades is going to become better and better at using these stem cells. So if our child was to ever fall ill, we felt it was a very sensible decision to have these banked for them. We never thought we'd actually have to use it. We felt that we thought it was going to be banked for years and years and years.
Of course, it was a decision well made because So tell us about the treatment, and what were the effects after the treatment? Did you see improvements?
We
we have seen improvements. I think for Georgia's quality of life, it has made a big difference. The transfusion itself is fairly simple. It's a day in the hospital. It's essentially like a blood transfusion. What comes out of that, you don't know. So she personally, I think, has made some significant improvements. She's much more aware of her world. She's much more alert. She's much more engaged with what's going on, which I think is going to make a huge difference to the way that she's reacting to all her other therapies. The cord blood is part of the plan. You still have to be doing intensive physiotherapy, occupational therapy, to help her learn to move, because her ability to learn and just have the natural human instinct is gone. So she has to be taught to do the most basic things. But I think that the cord blood has given her some fantastic building blocks. And we would do it again and again and again if we had that opportunity. We think it's a fantastic.
Is that necessary, Dr. Daly? Is it a one-time treatment, or do you have to follow up with similar treatments, down the road, months or years?
Yeah. Unfortunately, we're really early in the trials with cerebral palsy using cord blood. One of the pioneers, Dr. Joanna Kritzberg in the United States, has to date treated over 150 children, and there are centres all around the world that are getting involved in these clinical trials. But we don't know the answers to those questions yet. We believe that a second transplant would possibly be beneficial. What we're looking at here is giving the child back their own stem cells. So something that was privately stored at a cord blood bank like CordLife, and then transfused back. Why their own stem cells? Is because cerebral palsy is a birth injury. There's no disease. So these stem cells are the purest, and they're the child's own stem cells, so they carry no risk to the child.
There are only enough stem cells for a child, to treat a child, and not an adult. Is that correct?
That is correct when we look at hematopoietic, the blood diseases that we treat. When it comes to cerebral palsy, we're not quite sure what the dose is. It took them about 20 years to discover the optimal dose for hematopoietic stem cell transplant. With cerebral palsy, we believe it might be less. We're not quite sure. We don't have that answer yet.
To bank cord blood, I mean, it is expensive for a lot of people. In a way, it's a kind of insurance, but it's an expensive insurance, would you say?
Well, from our perspective, not at all. The costs of keeping Georgia happy and safe for her long-term care are phenomenal, and for this as an option is really insignificant in comparison to her overall medical bills. And it has the potential to really maybe change the way that she's going to be in the future. So although it may seem an expensive thing to do, over a child's lifetime, it may not be at all. It's actually probably cheaper than health insurance in a lot of ways.
We've got less than a minute here, but what would your advice be for parents who are thinking about it? I mean, what are some of the considerations that you would tell other parents after having gone through it yourself?
Well, it's a safe procedure, so there's no risk to you or the baby. It's a fantastic insurance policy to have in the background. You hope that your child is never ill. You hope for them to have a very healthy future. But if anything goes wrong, the technology is now there, and for us, knowing that there's a potential to help our daughter, the thought that we hadn't done it would have really killed us. So I think we're so pleased that we had that option, and I think that people should seriously consider it, because you never know what the future holds.
Okay, well, thank you to both of you for coming in and telling us more about cord banking.
Thank you. Thank you for speaking to Dr. Sri Daly and parent Georgia Khan on the pros and cons of banking cord blood.